Good morning, everyone. This is Jean Christensen, and we're going to go over some tools that you can use during open enrollment or any time during the year. You are all muted at the moment, but at the end of each document that we go through, if anybody has a question, I'd like you to unmute yourself then, and we'll talk about it, because I'm sure that there will be other questions, and it's going to be beneficial for others to hear what your queries are. So the first one I want to do is the Medicare intake sheet. And I'll pull that right up here. Okay, so we went over this at the boot camp. I know that a lot of you were there and a lot of you were not there. So this is a great way to keep track of what you're talking to your clients about. There's a lot coming in right now. You need some method to stay on top of it. So you're going to put their personal information, all of that, and then as you go along with the questions that you ask them, do they have Part A? You're not going to get all of this, but you need to know if they have A and B. You need to know if they have LIS, if they're with VA, TRICARE, or if they're a state employee. Because it's really hard when you drive to someone's home and you have talked to them about their doctors and drugs, and you've done all your research, and you sit down at the table with them and they say, oh yeah, I'm a school teacher, I'm retiring. And now the only thing you can write is a prescription drug plan, because the Plan F with the public employees is a far better plan than we have to offer. So, asking all your questions, as you know, what do they have now? And if you have a question about I think it's good to ask, is there anybody else that you would like to be involved? Because there is often a son or a daughter or a spouse that you'll want there. Rarely have I run into situations where people are not competent to make decisions, but it is starting to happen with a couple of my older clients, and I am starting to get children's phone numbers and discussing things with them as well. So of course you need your drugs, the dosage and the frequency. Just talking with someone yesterday, they take Restasis, which is an eye drop, which is expensive, but on Medicare.gov it shows that you need 2 vials or 2 times a day, which doubles the cost for people who really don't take that much. I have someone that just takes it once a day, and it dropped her cost significantly. So ask all the questions and do get their drugstore of choice. That's going to can make a big difference with that. And their doctors. Good idea to know who referred them to you so that you can keep track of that and say thank you. So that is all I want to do on this form. Does anybody have any questions? They can unmute themselves.
I have a question, Jean, on the asking for who else might be involved. Are we required to ask if they do have somebody as a power of attorney for health decisions?
Well, you're just going to have to kind of be led by the conversation. If they say, I want my son or daughter here, it's like, so they're advising you, or do they have a power of attorney?
Okay.
So you would ask that question then, and you're going to need a copy of it.
Great, thanks.
Yeah, okay. Anybody else? All right. Let's move on. We've already all been over that one. So let's go on to, so we have updated the networks at the boot camp. Again, we had a network passed out for 2018. It is still on the forms sheet screen that we just left. So you would need that for people who are turning 65 in November and December. But then you'll also want to check the 2019 ones. So here's the one for the HMO plans around here. So this is for King, Pierce, Snohomish, and I'm sorry that I haven't done it for all of the counties, but it is a template that you can do this for yourself, and it's a good guide for what's going on. The changes this year are actually, so if we go down here, so United Healthcare still has everybody. Aetna still does not have the Everett Clinic. Where's my Everett Clinic? There it is. Okay, that needs to be corrected. Everett Clinic. Okay, we're catching this stuff as we go along. So Aetna does not have the Everett Clinic yet. And I will have this updated later today. Another change, Premera. Premera previously in 2018 did not have Franciscan, and they do have it for 2019. So CHI Franciscan is included in the Premera network. The Humana network is the same, and it's interesting to note, if you're not familiar with them, for Virginia Mason on their HMO products, they have the hospital and specialists, but no primary care physicians, which is a bit of a problem. People tend to go to just one place and stay there. So anyway, so you want to be cognizant of that. And then regions, the changes for this year is Overlake and Evergreen are not in network. I don't believe they were last year in the HMO, but it's for all their plans now. No for Evergreen, no for Overlake. So this is, I do not include DSNPs for obvious reasons. Any questions on that? Before you unmute yourself, with these networks, this is a guide. This is not cast in concrete. This is a moving thing. And besides the fact that even if somebody says, I'm with Swedish, and you know Swedish is in the network, you need to look up that doctor. You need to absolutely verify that they are in the network before you move forward with a client. It's just, you don't want that call in the middle of the year that says, I thought you checked my doctor. They don't take whatever plan. That would not be fun. That would not be fun. So questions about the HMO? Anybody want to unmute themselves? If you have a question, please unmute yourself. No questions. All right. Let's go into the PPO for 2019. So again, we just have the three, the Aetna, Regents, and Humana in the Tri-County area. And there are, again, the only changes here are that Overlake and okay, so I got to check that too. So Regents on the PPO, I will correct. Overlake and Evergreen are not in network. This is creating a pretty big stir over here, and letters are going out from carriers, are going out from hospitals and doctors to their clients, and the individuals who go there know that they're going to have to change their plans on Regents if they want to continue to go to those providers. And again, this is a resource for you. Always, 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 always check to make sure each carrier is part of the plan. Questions on this? Unmute yourself and ask any questions you like. Wow, you guys are really quiet. Okay. So here we have, so the next one is a plan comparison sheet. And what I'm going to show you here is an example, a partial example of what I do each year. You're not required to do this. That didn't work. Serena? This worked a little while ago. I don't know why this isn't opening. It's going to download. Oh, there we go. It worked. It worked. Yay. Okay. So, all right. So this is the spreadsheet that I use. This is just an example of what I use. This is available. I mean, you can do whatever you want, but this is just to give you an idea of how you can do this. I know a lot of very successful agents that don't do this, and I know agents that do much more than I do. So every year, even though I'm familiar with all the different plans, I can't keep up with what the changes are. And, whether it's a small network change or cost or whatever. So I do a comparison. I did go ahead and put on here the United Healthcare plans for 2019 that I have already done. And then if you scroll down, I have included some blank ones so that you can take this form, copy and paste, and set up your own if that's something that's helpful to you. If you're a newer agent, it's the small details that are going to probably distinguish one plan from another. It's either network and drugs, and then after that, it's like, okay, so my doctors are in all plans, the drugs are fairly comparable, so why would I choose this one or that? And then we get down to the little stuff. On the numbers that I have here, the ones that are in parens it's what it was last year, 2018. I was going to remove that and I didn't get that done. So outpatient surgery is a big deal with all the carriers because it can, with the 20%, as you see here with the HMO2 and the HMO3, as well as the HMO2 and Kitsap and Pierce, it's a 20%, which, when everybody had just 20%, it wasn't a problem because that's all we had to deal with. But now carriers are coming out with flat copays for outpatient surgery, as you see on the HMO1. That's at $245. Different carriers have different amounts, but even having a flat figure, whatever it is very beneficial and a defining characteristic of a plan. Prescription drug deductibles are too, whether there's a fitness rider or not. United Healthcare is a strong carrier of ours. They do a great job for us. A lot of things are very streamlined with them, but they are kind of missing the boat on the outpatient surgery and no fitness rider on their zero premium plans. So those are some defining things, whether they have the over-the-counter, that's OTC, is the over-the-counter catalog for free Band-Aids, aspirin, cough syrup. They're, $40 a quarter, $50 a quarter. Those are pretty healthy. A lot of carriers do not have it. Amerigroup and Humana do, as well as United Healthcare. You can put down their preferred pharmacies or who's not a preferred pharmacy. With Aetna, you typically have everybody as a preferred pharmacy except Walgreens and independent pharmacies. But as far as the major chains are concerned with Aetna, you're going to see them all there. But if they go to Walgreens, their drugs could be triple. So I'd like to open this up to questions you have about carriers and about plans for 2019. If you have does this plan do this? Does this plan do that? I may not have the answer, but I can certainly get it if I don't. But this is what we're all interested in right now. So if you have some things you would like to know about a little more in depth, unmute yourself and let's talk about it.
Hello?
Yes.
Yeah. Good morning. This is Bill.
Bill, hi.
Yeah. So here's a question. It might be a little bit too specific, but maybe you could have some information on it. In Skagit County, Aetna has good plans. They have no hospitals
Right.
in the network. So I guess what I'm wondering is, in your opinion, what's the plan there when you're talking to somebody to overcome what may be a legitimate objection if they were thinking about switching from, let's say, Kaiser over to Aetna for other reasons?
I did just talk with Kelly Jones from Aetna this morning, kind of verifying some networks up there, and she said she felt like they are a little too early to jump into Skagit County since they don't have any hospitals. You'd have to go to Everett. So that is is a really big problem. I don't think that's going to be a seller for this year. I'll have to look into it, Bill. I believe Humana's going to be good, and United Healthcare is okay.
Humana
But I'd look at the Humana plans.
Humana in
Humana's
Skagit?
in Whatcom, and I believe they're in Skagit as well. I did do a spreadsheet on them, and I can go back and check and get that to you.
No, I think you're right. I've got that, and I can check that myself. My take on it
Okay.
for Skagit was if someone lived in Stanwood, or sort of down on the border, they're going to, a lot of those people are going to Everett Clinic anyway, and they could go to Providence, or they might want to. So that would be where it would sell. Otherwise, it's a tough thing to just a tough thing to deal with. And thanks for your answer.
Yes, you bet. Anyone else? Thanks, Bill.
Yep, I have some people who don't have mics and stuff that needed to have a couple questions asked. So Carla said that she heard Providence doesn't have over Lake Evergreen, and so she wanted to know if you meant Regents for all areas.
Wait a minute, say that again.
She said, I heard Providence doesn't have over Lake Evergreen. Did you mean for Regents all areas?
I'm talking about Overlook and Evergreen not being in the Regents plan. Am I answering that question correctly? Providence.
Maybe.
You can email me later, call me later. If I don't get, please do, because I want to get your questions right.
All right, I'll forward hers to you then, because she emailed it.
That would be great. All right.
I will forward that to Jean. So Joyce wanted to know if the info in the sample is correct, so you don't have to change it.
This one for United Healthcare? For the plan comparison? Yes, it is correct.
Okay. And then Sharon asked, would the network list be the same for MedSup plans as they are for the HMO plans? Looking for clarification on the difference between MedSups and MA.
Okay, on a MedSup, you can go to any doctor, hospital group, facility in the country without a referral, as long as they take Medicare. So a supplement works differently. On a supplement, Medicare, if Medicare pays, the supplement will pay for whatever and wherever you had it done. So if it's okay with Medicare, it's the Medicare Advantage plans that have networks. And they do differ carrier to carrier.
All right, it looks like that's all the questions for right now on the side.
Okay, anybody else? Okay, perfect. All right, let's go on. Here is also, this page is a great resource, and we're going to continue to update it. There's little challenges. So here, I hope that when you have your computer, your laptop, whatever you're using at home, that you have your favorites set up for Medicare.gov, so that you have just quick and easy access to this, Medicare.gov. And here are the links to the providers to look them up. I have this saved as favorites on my desktop, and it is, I just go right there when I'm looking for something. So just as a tool, you have that there. So the agent checklist, particularly when you first start, but actually anytime, some agents use this always, regularly. So this is after you've had your appointment, particularly for a Medicare Advantage plan. Supplements, not as much. So for a Medicare Advantage plan, you're going to finish the appointment. You've gone through everything. You've got their name on here, and then you go through this with them. And they're going to talk about, the company name, the plans you're representing, their star rating, people with ESRD cannot enroll, you know, the member resides. So you're going to go over this, and I would have them initial each box. And then, so look at this. So we've got what their copays are, hospital copays, do they have a gym membership, what's their emergency care look like, authorizations, prescription drug plan, did they select a PCP, did I select that they're in the network, and they know that you're contracted with them. So the agent signs it, you sign it, and your individual signs it. And I would keep this, scan it, however you're going to do it, and keep it in your file. It's just kind of a CYA kind of thing. I rarely have issues later on, but I do have people that have questions, and I do have people that don't remember things exactly. And this is just a way to remind them that, yes, we talked about this, and this is what I said, and, you know, you signed it, you know, if push came to shove, you would have something to go back to. And particularly if they know they've signed this, it's like an initial, all those things. It's another step. It takes a little longer time, but you don't have to have it take too much time. Yeah, late enrollment penalties, coverage gap, maximum out of pocket, all of those things. Just to make sure. If you don't use it and have them sign it, it's a good thing for you to have to remind yourself that you need to cover all of these things, particularly when you're getting started, so that you get all the boxes checked in your mind and they can check them on here or not. Questions about this?
Okay, so 2 questions. Bill is asking what LGD stands for.
Where are we going? Don't know. Okay,
Lou Gehrig's disease.
It could. Well, ALS is the same thing, but yeah, okay, that's probably Lou Gehrig's disease, yeah, which is ALS.
Funny.
I know.
And then Susan asked, what's the best source for filling out the spreadsheet? Plan SOBs at carrier websites. Will that have all the answers?
What's the source for filling it out?
Yes, like if you wanted to fill out that spreadsheet yourself and do it like you do, then are there a number of places that you go to get all those answers, or is there one great spot you can find most of them?
Oh, as far as each question that you're asked or that the client is asked?
No, actually, I asked that question during the spreadsheet portion of the seminar here. So it's regarding the plan comparisons.
Oh, okay.
My question was during that.
Where can you get that in? Okay, so the question is, where do you get the information for the spreadsheets? Good question. So the information for the spreadsheets is going to come from the benefit highlights and the summary of benefits that they send out. And what's difficult is you only will have, they give you this, quick benefits at a glance, their changes. They get all that out to you in August and September. But you need all the information. And this year it's been kind of late. It has been, the 1st of October before I've really had everything I needed, but because I'll look at the benefits and then I also want to check them in the summary of benefits. I'm sorry, you're going to look at the quick look, the glance, benefit at a glance, and then the summary of benefits. So that's where you would go. If you have questions on the networks for the different carriers or the preferred pharmacies, if it is not included there, I would go onto the carrier's website or call the representative for that particular plan.
All right, thank you.
Okay, sure. Serena, anything else?
It looks like that is all the questions on the chat for now.
Okay. So we have broker of record letters. So basically, so particularly here where you're looking at Premera, you know, Premera has taken over, come on guys, has taken over, as you know, for SoundPath. So if you're contracted with Premera, you know, people that want to stay with a SoundPath plan that is now, you know, called Premera, you can change them to you and start getting paid. So you just need them to complete this form and have them sign it. Here's the new you. They want to add you, your identification number, your information. And so there you go. So the member does need to sign it and date it, and then you submit it to Premera or whoever. You cannot use a broker of record letter with United Healthcare. You pretty much can with anybody else. On here, we just have Kaiser and Premera, but there is Humana and Aetna, and there are others, and we can get those loaded later. But if you run across somebody that has, you know, another carrier and they've already signed up and they're happy with that plan, if they don't have any other, if they signed up on telesales, called an 800 number, or worked with another agent that's not around anymore, or they haven't heard from, you can ask them, you know, just like you would keep them up to speed, you would let them know about the plan changes, you know, would they like you to be their agent? It costs them nothing, and they can sign these and you become the agent and start getting paid. It's a beautiful thing.
Follow
yes.
up on that statement right there. I was going to ask you a question. Thank you for doing 90% of that for me.
Okay.
So like, this is my first AEP, so I'm not quite sure what to expect, but I'm expecting that many people I speak with will already be on Medicare. How do you broach or bring up, do you just simply ask them, do you work with another agent now, or how did you sign up before, or how do you get onto that?
Yeah.
You know, when it's appropriate?
Yeah, the question is, you know, do you know who your broker is? Do you have a relationship with your broker?
Okay.
And it's pretty rare that you get a yes. You know, typically it's like, well, this was a few years ago. I haven't heard from him. I don't know him. I mean, I've done quite a few of these over the years as circumstances present.
And so basically it's all, well, if they have one plan and they're changing to somebody else with you, then you don't need to do anything, right?
That's correct, because you'll be the new broker.
Right. But if they have, well, like you say, United Health to you, but now you're helping with
It's
you.
not going to work there.
No,
Yeah, it's not going to work there.
the old agent still keeps it.
Yeah, and even, yeah, I've gone in and, you know, when I was first starting and I met with a gentleman that wanted to change his supplement plan from can't remember what he had, to a plan F, because he had additional health issues. And so I signed him up for the F, my name's on it, it goes in, the other agent gets paid.
Oh, okay.
Yeah. So that's supplements and Medicare Advantage plans with United Healthcare.
So I guess that's good and bad.
Pardon?
So I guess that's good and bad depending which side of the table you're on.
Exactly. So, but for the most of the carriers, it's pretty easy. It's in group health. I mean, Kaiser. A lot of these people signed up just coming off of an employer plan, and they just were kind of rolled over, and they don't have any contact at all.
Mm-hmm.
And so that kind of leads into another thing: is you don't want somebody else filling out a broker of record letter for you down the road and changing your client to them. So you need to keep in contact with these people during the year. Right. Dan always told me two touches a year. Some people do more than that. Some people call their clients near the end of January, make sure they got their cards, make sure their physician is listed correctly on their card for the Medicare Advantage plan, and make sure they don't have any questions then. some people do that, and or I do a letter in late spring with whatever's new. A year or so ago, I was talking about the Medicare cards coming out, or what a wellness visit means as opposed to an annual physical. You know, just something that's, I'm not asking for anything from them. I'm just trying to keep them up to speed. And what I'm really trying to accomplish is, remember me, I'm your broker.
Right.
I'm here to help you. And then I do emails and I do cards before open enrollment. And if there's any major plan changes, I'll call everybody on that plan.
Oh, okay.
Before open enrollment, or at the first of open enrollment. So whatever you want, some people do birthday cards and they set them up through Constant Comment and different places. So, you know, just do something. Do something to stay in touch with these people so somebody else isn't coming in.
Okay, thank
Is that
you.
good, Steve?
Very good, thanks.
Okay. Other questions? Alrighty. So just generally on this form, we're not going to go through everything here. If anybody is doing presentations, needs a guide for a basic presentation, we do have a PowerPoint. It is, let me get this up here. So if you were at the boot camp, you've probably seen this. This has my name on it. It does need to be updated because it has the information right now. So it goes through the steps that I would use to do a presentation. Some people use something like this on an individual appointment, particularly at the beginning when they're trying to, get the flow of what you say first, what you say second. And I can remember doing presentations in the beginning and even individual appointments, and I had already gone over eligibility and how you apply and all of that, and then I'd be well on into some other topic and realized I forgot to say something back up there. And you can't be jumping around and keeping people understanding. And the goal is really to make this as easy as possible and kind of take out all the extraneous details and kind of focus on what the basic coverage is for Medicare, what it doesn't cover, and what your basic options are from there. After you get through all of that, then you deal with their personal situation. But these people are overwhelmed. So this is just got your enrollment. I think most of you have seen it. So the numbers on this is $1,340 is 2018 numbers. We don't have them for 2019 yet. But that will change shortly. It'll change in the middle of open enrollment. So you've got your premiums, your deductible Part B. That will probably change again this year because that's been the same 2 years in a row. So anyway, this is available to you. There's all kinds of resources here to make your life easier, and you can take this and you can change it and make it your own. Just keep it compliant. The Medicare on this particular, let's go through this a little bit farther here. There are few numbers on this, so it stays pretty generic. It just has to do with the deductibles and the premium, but it does not go into any specific plan. So here we are in Medicare Advantage. It does not talk about any plans, does not talk about premiums, none of that. This is very generic and it's meant to be so that it's very compliant. There you go. So anyway, let's go back up here. So, okay, about the PowerPoint, any questions on that? Bill, do you have any questions? Serena?
Don't see anything.
Okay. Okay, perfect. Okay, and then you have your CMS forms here. Just want to show you those. So if you have, so you know what these are. So if you're someone turning 60, going on to Medicare after 65, these are the two forms that they will need to get enrolled in Medicare. This is the first one that has just their individual information. This is page 1. They should put in the remarks section here what month they want their Medicare to start. Since they're retiring, Medicare doesn't know. If they send their forms in and don't have this completed or any statements here, they're going to make it the first of the next month. If they were really just being proactive and it's a couple months down the road, that's not good for them. So this form and the employer form, this is the second form that needs to go in if someone is retiring after 65. This goes to their employer for their employer to complete. Here we go. So their employer is going to complete this document. It's going to come down here. It's going to say, you know, have they had group health plans? What was the date that coverage began, ended? Is it still going? Is the employee still work for you? They're going to ask all that questions. And those two forms need to go into a Social Security office for them to get their Part B started after 65. I suggest not mailing them some because you can't track them to the Social Security office. I would either have them go in, or some of the Social Security offices have a drop box right there, so you can just drop them off. So just trying to track that. And they need a good 4 weeks to process this. So they need to be working on this. It could be sooner, but it's often been 4 weeks. Okie dokie. I think that,
Hey, Jean. Hey, Jean.
Yeah.
You had two questions about the forms. So I think the first one was when you were looking for stuff, 40B set web form. And just wanted to know what the abbreviations are in the circles.
I have no idea. This is Medicare form. Who knows? Yeah, I don't know what those mean.
Yep. Okay.
Sorry about that.
And then Sharon wanted to know, does this employer form used for coming off group coverage and accompanying a Part B app? And can I submit the form on their behalf, or do they have to do it?
I would not submit the form on their behalf. This is, you're going to help them with their Medicare plan. They need to get this done. This is their responsibility, and I would not want to take on the responsibility of whether that form got there or didn't get there and it got processed. I would definitely leave that up to them. You know, I know it's helpful to people, but they need to find a way. This is their responsibility. That's my 2 cents.
Hey, Jean,
Any
I've got
other
a question?
questions?
Yeah, I've got a question. This is Susan. Yeah. Are these documents something that the employer HR department would typically give them? You know, if someone was the type that was proactive in going to their HR department?
Rarely.
Rarely. So this is something they may not have heard of or known about before.
They've heard of it. I'm sure they've heard of it, the HR people, but they don't. They typically don't move from what they do with the employer, with their own employees, to what Medicare does. It's very interesting, and it is an opportunity for people, you know, because employers can't explain Medicare. They can't explain, you know, when you get on Part B or coming on. I mean, it is really rare to find someone that knows what they're doing.
Okay.
So this is actually an opportunity to go to those places and say, do you have someone who helps your employees make this transition? And typically the question is, huh? It's like, hey, this is what I do. Any other questions? Did I answer that, Susan?
Yes, thanks a lot.
Okay. Any other questions, Serena? Serena?
Doesn't look like it.
Okay.
Yep, it didn't look like anyone else has anything.
Okay. So I'm not going to go through everything here. There's lots to know. Take a look at it. You can always email me if you have questions or comments, or, you know, I am happy to help any way possible. You also have your GAs, which would be your first stop. But for a quick question, I can certainly help as well. But this particular page is a great resource for you. And, you know, I'm just going to stop on one more. Let's do the PEB rates. So PEB is public employees. This is teachers, principals, not bus drivers, not maintenance, but they are eligible for coverage when they retire through the state. Teachers are state employees. So as we go down here, this is we don't have the 2019 numbers yet, but if they were to go on to, hold on, if they were to go on Kaiser, it'd be $173 a month. They have a couple different plans for Kaiser there. As we know, Kaiser offers plans for way less money. So there are opportunities. However, if you do not go on to the state plan and stay on the state plan, if you leave it, you cannot go back. And the thing to note here is while the Kaiser plans are more expensive than what we know are available, they also have the last one on the list, universal medical plan. That's very expensive. But if you look at the Primera Medicare Supplement Plan F for retired people, it's $111. We also know that a Plan F is far more expensive on the open market. So when people call me about, and I find out that they're school teachers, you know, I tell them that PEB, the state, offers them the best plan around. They can get 100% coverage on a Plan F, and it's only going to cost them $111. They will still need a drug plan. You can help them with that if you like, but they really should do that. So that's, and you can get this form, you can get these costs online. You can just go in for, you know, PEB Washington rates, and when they're updated, they're always available to you. So this is as current as we have through today. Anyway, so lots to look at here. If there are other things that you would like us to add to this page, please let us know. Let me or Susan or Serena know what you would like to be added. But if there are there any other remaining questions? If not, that's it for today. Next week, Ellen Brighton is going to help us with Medicare.gov and going through looking up drugs, what to note. There's just a lot of detail to this, and she is the expert. And so we'll be talking to you again next Friday at 9 o'clock. Thanks for joining us.
Thanks, everybody.
Thanks,
Jean.
Jean.
Thanks, Serena.
Okay.
Bye.
Bye-bye.
Bye.
Bye.